Welcome to the cityCURRENT Show, powered by Higginbotham Insurance and Financial Services.
This show focuses on sharing good news and powering the good in our community. Now here's your host, cityCURRENT CEO, Jeremy Park.
Welcome back to the cityCURRENT Show, powered by Higginbotham. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And we always love having our cityCURRENT partners come on the show talking about their world and sharing their expertise. And that's why we're so honored to have with us John Lewis. He is the CEO of Semmes Murphey Clinic. How are you doing?
I'm great. Thanks for having me, Jeremy.
Absolutely. Well, when you talk about Semmes Murphey Clinic, amazing legacy in the Mid-South, amazing work that you and your team are doing. And so we're going to dive into that for sure. But let's start with a little bit of history. Give us some history and some background for Semmes Murphey Clinic.
Yeah, so we've been around a long time. So we're an independent physician-owned spine and brain care practice, and we were founded in 1912. And so basically what we do is we treat everything that has to do with the nervous system. And the background is Dr. Semmes grew up in Memphis. He actually went to Christian Brothers High School. And what is unique about him is that he trained directly under a physician by the name of Dr. Harvey Cushing, and he was at the Johns Hopkins University Medical School. And Dr. Cushing was a pioneer in the field, and he's generally considered the most influential American neurosurgery of the 20th century. And so Dr. Semmes would return home from time to time, and when he came back, he realized that there was this real need for neurosurgery in Memphis. So he eventually came back, and he was the first neurosurgeon to practice in Memphis, practiced here for a number of years. And then after World War II, he had an associate, Dr. Murphy, and he and Dr. Murphy incorporated what is now Semmes Murphey Clinic. And Semmes Murphey Clinic has primarily been responsible for the growth of neurosurgical specialties in Memphis and for the growth of the Department of Neurosurgery at the University of Tennessee Health Sciences Center. And if you fast forward to where we are today, we're a multi-faceted practice. We've got 40 plus physicians. We've got a number of neuropsychologists, and we have a full complement of staff from physical therapists, physician assistants, nurse practitioners, and the like. And they collectively can treat things from like headaches, complex spine deformity, brain tumors, endovascular illnesses. Endovascular are things like strokes and aneurysms. And so to kind of give you an idea of what a typical day might look like, we could have doctors that are, doing brain tumor surgery in a pediatric hospital. We might have somebody doing a stroke intervention at a hospital. You might have somebody doing spine trauma surgery, either in the emergency room or at like Regional One Health. We have people that do elective spine surgery. They might be doing that in our surgery center. And then we have people doing conservative things. So we might have somebody doing a memory care assessment in the office. We might have somebody doing conservative care physical therapy in the clinic, or maybe they're having an MRI image. I do think one of the things that makes us pretty unique is that we've remained an independent practice. And so our doctors can see patients at any hospital in the greater Memphis area, including some places outside of Memphis, like Jonesboro, Arkansas, Jackson, Mississippi, Oxford, Mississippi. So we basically go everywhere we need it. If there's a patient that needs to be seen, we can see them pretty much anywhere they're needed to be seen. Another thing that I think is a little bit unique about our physicians is that they are typically very involved internationally. So they're internationally recognized. They'll lecture and teach around the world. And then we invite physicians from around the world to come to Memphis and observe and train with us and get to know the community. And because of our doctors' experience, we're a medical destination for patients from around the country and around the world. One example is the fact that minimally invasive spine surgery, so that's surgery where they make a much smaller incision, and that's considered standard practice now, by the way, was developed by some of the neurosurgeons here at Semmes Murphey back in the 90s. And then, I don't know, most people are probably not aware that Semmes Murphey was a founding partner in the Medical Education and Research Institute. We call it MERI, M-E-R-I. And MERI is a world-class Memphis-based bioskills lab. And it's right here in Memphis. It's near the corner of Cleveland and Union. A lot of people don't know that it's there. But in short, Mary plays a large part in expanding Memphis' international reputation for things like medical innovation, particularly in brain and spine care. It's a place where our physicians and our residents can train on new procedures. And then in turn, Mary offers training courses to physicians from all over the world. So we bring physicians in to Memphis, into Mary to do these training courses because it's just a really world-class facility.
See, I think that's what's really amazing is when you look at all the things that you're doing, literally putting Memphis on the map on a global scale. And when you talk about the surgery innovations, I mean, there's so much that all goes through Semmes Murphey Clinic, which is really special. And so talk about the field, because when you talk about your team, the specialization, the innovations, talk about, when you talk about like neurosurgery and what that really entails for those going down that path. Talk about the training and the education that goes in for you and your team.
Yeah, so neurosurgeons train for a minimum of 7 years. That's the required residency period right now. However, most neurosurgeons now subspecialize, so they'll go into a fellowship program, say complex spine, for example. And so the true training period for a neurosurgeon after fellowship can be up to 9 years. So that's a really long time. And the reason the training is so long and intense is that it's your central nervous system. So that's your brain, your spinal cord. And if you look at a diagram, you'll see that the brain and spinal cord basically connect to every single part of your body. It's just an incredibly complex, very delicate system that requires extensive experience. Overall, because I think in part because of the length of the training period, neurosurgery tends to be a smaller residency. They've only got just over 200 positions that are offered in neurosurgery training programs. There are about 115 training programs around the country. So residency programs are highly competitive. Nationally, only 74% of applicants match in neurosurgery programs, which is compared to a 90% match across all other medical specialties combined. Semmes Murphey manages and has always chaired since the beginning the neurosurgery residency program at UTHSC. Next year, we expect to have 21 total residents in what is now a 7-year program. And it really is one of the best training programs in the country, I think, because of the hands-on experience that the residents are exposed to. We have literally hundreds of applicants who apply for 3 positions every year. And then, as I mentioned before, with respect to fellowships, in addition to the residency program, we have several very active fellowship programs in things like pediatric neurosurgery, complex spine, endovascular, which I mentioned was stroke and aneurysms. And we have one of the largest endovascular teams in the country. So that is an extremely strong program. But at the end of the day, I think a lot of Memphians don't realize that, we're a relatively small metro market, but we have a first tier healthcare system in general. And we have a first-tier training program at UT, and we are able to offer first-tier neurosurgery care right here in Memphis.
And I think, once again, that's why these interviews are so important, because it's sharing the good news, but it's also talking about, just like you're saying, hey, this is what we have right here in Memphis. And when you look at Semmes Murphey Clinic and the innovation, the leadership within this field, it's powerful. And so all good news that we want people to know and understand and appreciate. And so this will lead us into the Brain and Spine Network and the Center of Excellence. But talk about how, in many cases, some of the things that you're feeling, especially with your spine and working all day and sitting in a chair, some of the things that might be something, but it's really a spine issue. And so talk about some of the things around workforce and taking care of yourself and being proactive. And where I'm going with this too is the fact that you and your team are very proactive, but very conservative in terms of, hey, let's figure out what's really going on and how can we, address this. And so many, myself, our older son fell and hit his head, and you all took care of him. I know that our team, Andrew and his family, like so many have a personal tie to Semmes Murphey Clinic, but being proactive in addressing, issues. And so talk about that side of things.
Sure, yeah. And this is something that I think we really have to do a better job educating the public about. But a lot of times problems with the spine will show up looking like something else. So for example, you might have an issue with your cervical spine, that's the neck, okay? And those will often present as things like shoulder pain or arm pain, or maybe pain that radiates down into your arm. Or sometimes, if it's really bad, it gets down into your hand. You can have tingling and numbness in your hand or fingers. Issues with the lumbar spine, that's the lower back, often present as things like hip pain. Like you might have pain in your hip joint, pain at your belt line, leg pain that radiates, or tingling, or pain in the side of your foot or your heel. So patients will frequently come to us after they've been to multiple other specialists because they're trying to figure out what the source of the pain is, and they can't figure it out. So it can be really frustrating. So what I hope that our listeners today might learn is that, come see us first, not last. Our team can assess the symptoms. We can get you to the next best place. Sometimes that's at Semmes Murphey, sometimes that's some other place. But the other common misperception I think that people have, and maybe a fear, is that visiting a neurosurgeon always means having surgery, and that's really not true. Our approach at Semmes Murphey is pretty conservative. As surgeons typically say, surgery is a big decision, and it's not always the best course of treatment. And in fact, if you look at it, only a small percentage of spine issues actually require surgery. And I'm talking about single digits, okay? So conservative care many times can be the best option, and it might start with something like physical therapy, or maybe oral meds like a dose pack, or maybe a pain block, an epidural pain block, to see if some of these non-surgical approaches might work. And a lot of times it really does. And I can speak from personal experience. I had a lumbar issue several years ago where I had this pain. It was, radiating down my left leg. And initially, I was able to control my symptoms and kind of work my way out of it over about a 4-year period through a combination of things like physical therapy and epidural blocks. And then later, I had an incident where I lifted something heavy and I re-injured the same area. And the pain eventually, started to radiate down into my foot and was impacting my ability to sleep. And I remember very clearly when I reached that point of needing surgery, and a guy named Dr. Clarence Watridge, who's one of our retired surgeons, met me in the surgery center. He met me there, I think, at 1:00 in the afternoon. He prepped me. I think he started my surgery around 2:00. We were done by 3:00, and I was discharged home by 6:00 with significant relief. And so it was a great experience, but I have to admit it was really interesting being on the other side as a patient. But I'm just really grateful for the guidance that I received and the fact that I can live without, that constant pain, because pain, even if it's just, minor pain, can be really, really debilitating.
Carry that into then the Brain and Spine Network, Center of Excellence, this partnership, but it really opens up the opportunity for the community to be proactive in their health, just like you're talking about.
Yeah, so the Brain and Spine Network is a Center of Excellence spine care program for employers. And as you said earlier, the program is a joint venture between Semmes Murphey and Baptist Memorial Healthcare, and it's an employer-based offering. So companies that join the Brain and Spine Network can offer their employees direct access to, high quality care for acute back and neck problems, among other things. But if you look at, back pain and headache, they're the primary causes of missed work days. And these health-related issues typically lead to reduced performance and pretty substantial lost productive time. Typically what we see is employees with back pain have higher absenteeism, so they might average something like 4 more missed work days. And so it can be really expensive for an employer. So companies that take this proactive approach to employee spine health quickly discover that the benefits of that far outweigh the cost, okay? And employees of companies that participate in the Brain and Spine Network typically have faster return to work rates. And I think almost more importantly, they have higher patient satisfaction than patients who have to navigate on their own. So the feedback we get from the patients that we treat through this program is really, really positive.
And I think too, for employers, what better way to say we want to take care of our employees, provide this sort of access. And just like you said, any sort of pain or discomfort, it especially like the lingering, it just is something that becomes a nuisance. It leads to absenteeism and lost productivity and happiness, loss of happiness. And it's like, you want your team to be happy, you want to be productive. And in the end, everyone wins. And having access to Semmes Murphey Clinic and your team is powerful. And so, Talk about website, talk about where we can go to carry these conversations forward. You and your team being cityCURRENT partners are nice enough to put up even a special link. So it's like, you're making this special all the way through. So talk about where we can go to carry these conversations forward.
Yeah, so if you go to our website, it's semmesmurphey.com. So it's SEMMES with a dash, Murphy, and everybody forgets the EY. So it's Murphy, MURPHEY.com. You'll see this big request appointment button on that page. But we've also created a forum that is just for cityCURRENT listeners. And it's the same website, semmesmurphey.com/cityCURRENT, all lowercase, all one string. And that forum will come directly to me and some of my staff. And so we can, take that and take care of the people who have an interest in learning more about the program.
For you personally, give me one more thing that you wish everyone knew about Semmes Murphey Clinic. When you look at the legacy, the innovations, the care, the specialization and expertise, all the things you're doing, give me one more thing that you wish everyone knew. And where I'm kind of thinking is like the heart for serving the community, but what's one more thing that you wish everyone knew about Semmes Murphey Clinic?
I don't think we do enough to promote what a great place it is to work for. The physicians here are just incredible, but it's just a great environment. And I think when you have a great work environment, that leads to happy employees lead to better customer service. And so that's something that I think we need to do a better job of promoting that.
Well, good stuff for sure, all the way across the board. John Lewis, CEO of Semmes Murphey Clinic, thank you for your cityCURRENT partnership. Thank you for all you and your amazing team do to power the good. Thank you for coming on the show.
Yeah, thanks, Jeremy. I really appreciate the opportunity to share a little bit more about the clinic and build some awareness in the clinic about who we are and what we have to offer.
Higginbotham Insurance and Financial Services is proud to power the cityCURRENT Show. We're a people-first company that protects what matters most, the families, businesses, and trailblazers that keep our community going. As one of the nation's top independent insurance firms, Higginbotham is a single-source solution for business insurance, employee benefits, HR services, and personal insurance that's customized for you. We're here to serve you, the people you care about, and your community. Call 866-377-1959 or visit higginbotham.com.